All right. Well, it is, as we talked about earlier, we're doing a special program tonight, one of our special Doctor Chat editions. And we're really excited because this week is National Women's Health Week. And all week long at lunchtime, we have had some special lunch and learns with guests. We've talked to Carol Green, who did our quarantine Powerball challenge. And you can go back and watch that on Facebook as well as our YouTube channel. On Tuesday, we talked with Betsy O'Brien from NAMI Piedmont Tri-County. Got some really good information from her. Yesterday, we had Michelle Wilson from Pure Escape Resort. We were talking about self-care and skincare and massage therapy, and I think we're all ready for just a little TLC. But today at lunchtime, we also had Amy Hansen, who is an exercise physiologist. She was my exercise physiologist back when I was in cardiac rehabilitation after my heart attack 8 years ago. So we talked about fitness, we talked about exercise, thinking of exercise as medicine and how it can help us heal our bodies and protect our hearts. Not just our heart health, but fitness can actually help us prevent about 40 other diseases, including several forms of cancer. So fitness is important at all ages. You're never too young, never too old, and to get started. So this evening, what we have is we have one of our special series on Dr. Chat. And one of my favorite people is Dr. Susan Demchak. I'm going to bring her on, and there she is. What a lovely backdrop you have there. That's very relaxing.
Yes, very zen.
Very zen. So this is Dr. Susan Demchak.
It hasn't not been a horrible place to quarantine. I'll be honest with you.
I totally agree.
It's Briar Patch anytime.
Because we don't live that far apart from each other. I think maybe 2 miles. And I'm blessed because I can always walk out my front door, and I walk 15 minutes and I'm at Lake Wiley, and I can meditate and breathe and just relax, and then I walk back home. But there's something very calming to me about the water, and maybe it's because I'm a Scorpio.
Maybe.
I don't know.
I'm Pisces.
Maybe.
And and I think we came from water. We've spent the first part of our life in water, so I think that is, and it's, for the most part, it's quiet underwater when you swim. Swimming is a very relaxing exercise because it's so. I remember swimming in the pool when my sons were little, and they would be trying to get my attention on the side of the pool, and I could hear them, but it's like, I'm going to pretend I don't hear them.
Oh my gosh. Well, you are a gynecologist and OB with Piedmont GYN OB. And we're just awfully glad to have you because I think especially with women's health, it's really important, I think, is when women go in, and for some women, about the only doctor they ever see is their gynecologist. And I know it's really important for you and for your patients, the fact that, you have the ability to take that time and to talk about, their overall health, on how everything works together. And so we kind of teased today's show that we were going to talk about the M word, which is that menopause word, the M word. But I think it's good too for even younger women to understand how to take care of themselves now, even through their childbearing years, because we know that just because you're younger doesn't exclude you from having cardiovascular issues, and how you can protect yourself throughout your childbearing years into those premenopause years, menopause, postmenopause, and just really to pick your brain and get some really good tips for the ladies today.
Well, Sheila, when I breastfed my babies, I learned that even though I'd been to medical school and I did a residency and I learned all about the physiology of lactation, until I actually had children and nursed them, I realized, wow, I was pretty ignorant about all of this. And it occurred to me, I hope that I am not as ignorant about menopause because I haven't actually experienced it as I was about nursing. And I don't think so. Things have changed a lot since I started doing this. When I did my menopause clinic in residency, if you presented to the menopause clinic having symptoms or just having had your period stop, you left with a prescription for hormone therapy. That was it. And so in 2002, I was at the beach, Ocean Isle Beach. You remember where you were? Well, you don't remember you probably remember where you were when the Challenger blew up. A lot of people,
Oh, yeah.
They remember where they were when John F. Kennedy was shot. Well, I remember where I was when I heard that the Women's Health Initiative had been published, and that instead of actually decreasing women's risk of heart attacks by giving them hormone therapy, we were actually increasing them. And I was in the Navy. I was stationed over in Jacksonville, North Carolina. I was a little bit down the beach, and I could hear the phone ring. I felt like I could hear the phone ringing from all my patients, my menopausal patients that I had put on hormone therapy, that were now calling going, "Oh my goodness, what have you done to me?" And I think that we learned from the Women's Health Initiative that not every single woman needs to be on hormone therapy. There are benefits and risks. And getting back to just this general subject of menopause, by definition, it's the cessation of menses. Now, it's a retrospective diagnosis, meaning you look back a year later, and you go, "Oh, that was it. I'm definitely menopausal." But in the meantime, some women are going through these horrible transitional symptoms. The hot flashes, night sweats, can't sleep, depression, lack of mental clarity, weight gain, lack of sex drive. And it is just, for some people, it's miserable. For other people, it's fine. They're not experiencing anything except for their period stopped. And so we have to individualize care of these women. And so my main message to all women is that at every age, you've got to take care of yourself. One of the things I love to tell people is everybody's healthy till 40. And then at 40, and ideally, you're taking care of, it's kind of like you're putting money in the bank, getting ready. You're making these habits. You're doing your 150 minutes of exercise a week, your whole life. But at 40 is when you really start to tell the difference between people who are taking care of themselves and people who have not found time to exercise, or have not eaten healthy. And sometimes people just have it's bad genes and things like that. We're all extremely busy. Healthy food is hard to come by. Meanwhile, it's easy to go pick up something that is convenient and fast. And so our world is hardwired for us to not be healthy. It has to be intentional. So the little speech I give is everybody's healthy till 40. Then at 40, it becomes a part-time job. And then at 65, it becomes a full-time job. So you have to quit your other job and spend, if you want to live, you spend the rest of your life, eating healthy, getting plenty of sleep, exercising, going to your doctor's appointments, and that type of thing. We don't stop growing until 35. Most people don't realize that. You continue to develop until you're 35, and then you quit growing and you start aging. And that slope can be a downward, a really steep downward slope, or it can be a slow aging process. And the idea is that we age as slowly as possible. And, you were talking about health at any age. Your pregnancy is essentially a stress test of your body. If you are predisposed towards heart disease or diabetes, a lot of times those things pop up. When I see a new patient at 56, I take a pregnancy history from her.
Wow.
Your babies, how much did they weigh? Did you have any problems with gestational diabetes? Did you have gestational hypertension or preeclampsia? Because that kind of gives me an idea of the past, gives me an idea about the future. Certainly going into midlife, being healthy is a great thing. However, it's never too late to start, forming those new habits, making small changes. your 150 minutes of exercise a week. Ideally, 75 minutes of that is exertional. When you are exerting yourself, you're secreting growth hormone. Have you ever heard that?
I did not. I know that it kind of unlocks, with exercise, it kind of unlocks the ability for your body to make its own medicine. So it actually, you can self heal. But as far as your growth hormones, no,
Yeah.
I did not know that. Okay.
The more you exert, and granted, getting up and walking your dog is better than sitting on the couch. So
Yes.
certainly if you're walking 150 minutes a week and it's a stroll, great, fabulous, more power to you. But to get the most bang out of your buck, you want to be sweating, you want to be exerting. And some days you want to be saying, I'm just not into this today. Some days it feels great, some days it doesn't. But the time that you are actually exerting, sweating, huffing, puffing, that is when your brain is making growth hormone. And we don't make growth hormone in midlife. After 35, we're grown. We don't make growth hormone. And growth hormone is your fountain of youth. The closest thing we have to a fountain of youth is exercise. And of course, healthy eating, avoiding sugar and processed foods and trans fats, and, lots of 5 to 6 fruits and vegetables a day, a couple of servings of lean protein about the size of the palm of your hand. That's your fountain of youth. So I try to tell people that, yes, you want to be exercising, but when you are huffing and puffing, and truly, if you're jogging or you're on the treadmill and you're feeling, I always try to tell myself, I really am not enjoying this, but this is the important part of the workout. The part where I want to stop is probably the part that is helping me the most. So you mentioned self-care with Michelle yesterday, and oh my goodness, I'm due for an appointment to get some self-care. My hair is like longer than my boobs, so I got to get, ready. It's time to get in there and get that trimmed. But self-care has kind of been painted as, your manicure and your facial and your massage and all that stuff. But self-care is as simple as, planning your lunch the night before you go to work, leaving for work 5 minutes early, buying yourself extra pairs of socks and underwear so that you don't have to find whatever it is that you struggle with, figure that out and do it. But, getting back to the whole, the hormone therapy thing and the whole menopause thing, the changes people will notice in menopause is their periods change sometimes. They may get shorter and lighter and further apart. They may get heavier. The star may burn brightest right before it burns out. So sometimes they're having some, pretty spectacular pyrotechnics. They have to come and see me. We have to figure that out. Hopefully we can figure out something that is not too, invasive. But one of my biggest issues is, making sure people don't get pregnant during the perimenopause. You are not, unless your husband has had a vasectomy or your partner, or you've had your tubes tied, you're at risk for pregnancy during the perimenopause. And a lot of women find themselves in that position. So that's number one. And we can address that sometimes. And also, a low dose birth control pill, if it's not contraindicated for some other reason, for example, heart disease or high blood pressure, sometimes a low dose birth control will hit all 3 of your points: your birth control, your cycle control, and your hot flashes. So that's one thing. A ton of women have marinas in the perimenopausal years, and also, even postmenopausal. It's not FDA approved in the United States, but we're using it for that. Your progesterone in your hormone therapy is, you don't get the same risk of heart disease or adverse effects on your lipids from using a Mirena IUD that you would from an oral progesterone. So very often for people who have the perimenopausal abnormal bleeding, once we rule out something like an endometrial cancer or something like that, we will offer them a Mirena, and it works great. They love it. Sometimes their period go away and they're like, great, I feel like I've had a hysterectomy and I didn't have to have surgery. And so it can stay in for 5 to 7 years. But
Wow.
you are not protected from pregnancy unless you have had a year of no period over the age 50 and 2 years of no period over age 40. And sometimes we will do lab work just to kind of reassure us that, this is what's going on. If, women will come in and say, I think I'm going through menopause. I need lab work. And I'm like, why do you need lab work? And they're like, well, I need to know what my estrogen level is. And I'm like, well, if you're still bleeding, you probably have estrogen.
Mm-hmm.
If you're not bleeding, you probably don't have estrogen. I'm glad to, if you really want labs, I'm glad to, or I'm never going to say no. I hardly ever say no to anyone. So if they want lab work, but the issue is I treat patients, I don't treat labs. And so, if you looked at all my patients, there would be patients who their FSH, their follicle stimulating hormone is way high. They're not having any symptoms. They're happy as clams. They have no hot flashes. Their periods have stopped. They're fine. Meanwhile, you have somebody who is miserable. She's
Mm-hmm.
having hot flashes. Her periods are still going. She's crying because she can't sleep at night. And you check her hormone levels and they're totally normal. So years ago, I gave up on hormone. I don't know that I ever really was a believer in hormone levels. Some of my partners do them, and I do them just to make people happy. But I don't, I don't. And, certainly checking a thyroid. You want to check a thyroid. Sometimes
Mm-hmm.
we'll check a prolactin level to make sure, you don't want to think that somebody is menopausal and really she's got a pituitary tumor. That's bad.
Right.
So there are things that can be going on. You can't just necessarily assume that somebody's going through the change. The whole hormone therapy, that is something that has to be discussed between a person and their doctor, to go over all the nuances. But a young menopausal woman, like in her 50s with early 50s, menses have just stopped, symptomatic, she's probably a good candidate for hormone therapy with very little risk as far as heart disease or thromboembolic events. Somebody in her 60s that just for some reason decides now I want to be on hormone therapy and comes in and says, that's probably not a great option.
Yeah.
Things that we offer people who are not good candidates for hormones, SSRIs, Effexor, Paxil also works for hot flashes. You also have the issue in menopause, and you may have dealt with this issue. It's this strange thing that every single person in the world is annoying. I don't know if you've ever dealt with that, but sometimes you have that every single person is annoying. I'm having hot flashes and every single person in the world is annoying. And I have to say, well, probably not every single person is annoying. It may, have you thought about maybe it's you, something's going on with you. So a lot of times we can kind of kill birds with two stones, or I'm sorry, kill two birds with one stone. There are times when people are so upset and just so out of sorts that I just kind of give them the triple whammy, the hormone therapy, the antidepressant, and then some Ambien to help them sleep at night until the hormones and the antidepressant kick in. And then when they come back and see me and they're feeling better, I will say, do you want to change anything? Do you want to start peeling these things off? But my inclination when I have somebody who's in distress is to try to do everything I can to try to make them feel better. So,
I think it's like it's like childbirth, because I remember with my first child, and you're going to laugh when I say this, but I remember being very young and pregnant, and the older women in the neighborhood came to pay a visit, and they brought their beautiful little crocheted blankets and booties they had made for me, and it was so sweet. And then they began telling me their childbirth horror stories. Scared the daylights out of me. And I'm thinking, oh my God. One little old lady grabbed my hand and she says, sweetie, it's the nearest to death's door you're going to come.
I have heard that. Yes, I've heard people say that.
Yeah. And then as you get older, and for me, and my parents laugh when I say this, my mom, because I slept through childbirth. Literally, I shut down, went to sleep, and I had no epidural, nothing, little Demerol. But I slept through 6 hours of labor, 6 hours of labor. So I had nothing of that experience. And then you get older and you begin hearing everybody else's horror stories about menopause, and you're going, Jiminy Crickets, do I have to look for? And I would hear my friends, my older friends, talk about this, and I'm going, oh my gosh, no, that wasn't the nearest to death's door. That's the nearest to death's door. But I did not go through that.
That's the nearest to somebody else's
death's door. But I did not go to, I literally, I had, I think because I had some other health issues going on, and I was taking some medications to help me sleep and things like that. And I think that probably helped mitigate some of my symptoms. But I never had the horrific hot flashes. I mean, mood swings, maybe I'd have to ask Bill. But as far as, one day it just stopped.
Yeah.
And that was it. And I'm just going, but I was 49.
Mm-hmm. So average age is about 51, but women start noticing changes in their periods as early as, late 30s. But very commonly, ultimately sometime between 45 and 55 for most people. But, your story is not that uncommon.
Yeah.
A lot of times people, it's just very, it's very nice. Their periods get shorter and further apart. And then one day they just don't show up.
Yeah.
Certainly after you've been without a period for about a year, if one shows up or any type of bleeding shows up, you need to seek, attention. And then even after 6 months, if it shows up and it's weird, it's long or heavy or it just isn't quite right. And it's never wrong. If you have questions, just call the gynecologist, because the endometrial cancer is one of those cancers that's very survivable. Most people are diagnosed early in their course. And the reason is because there is a warning sign, and the warning sign is bleeding. So you kind of have to listen and make sure that, when you're hearing people talk about, because a lot of women just think that anything goes as far as their periods around menopause. And that's just not true. Now, certainly you do a lot of negative evaluations to find that one case of endometrial cancer. But I tell you, like 2013, I think I diagnosed like 15 cases of endometrial cancer. It's more common because of the prevalence of obesity, and it just is one of those things. If you have any questions about your bleeding pattern around perimenopause, it's good to talk to the doctor. And then certainly if your periods stop and then they come back, then definitely that needs evaluation.
Can you tell us why, just out of curiosity? I know after my heart attack, one of the things I learned that I didn't know about women's heart health specifically was that women who have gone through menopause early, prematurely, that they're typically at higher risk of heart disease. And we typically see heart disease in women around the age of 55, although we're seeing it younger and younger every day. What is the tie-in between those things?
The lack of estrogen, just that, why do men and who knows why that is, and who knows why for so long that we thought that women, and I think that there are still studies ongoing about the effects of estrogen on heart health. And the whole, the testosterone and the androgens, once the menopause is over, once you go through the menopause, your adrenals and the peripheral conversion, you keep making androgens on into your 60s. That's why we don't take ovaries out of women just automatically, just because they're in their 50s when we do a hysterectomy. After age 59, typically we will, but you will keep making androgens on into your 60s. And that is why you notice, the estrogen's gone. All of a sudden, for some people, the facial hair shows up. Instead of the pear shape, you end up with the central adiposity. And I think it has to do with the testosterone, the effects on the lipids, and there's probably like inflammatory matters that may have also had to do with why the menopause was early, that also have to do with the heart health.
I would agree with that.
That is a very, women who go through surgical menopause because of endometriosis and their ovaries are removed early. That is something to be, you're looking at somebody and you think, okay, this is a 45-year-old woman, but actually, her heart disease risk is higher than a 45-year-old woman. So again, that's where the individualization of care comes about. The whole thing also with, if you want to go down a rabbit hole, read about dementia and hormone therapy versus the use of hormone therapy to prevent dementia. And there is this whole school of thought that, it's beneficial. Although if you really look at the studies, there's not an absolute, menopause helps prevent the onset of dementia. And I think that has specifically been looked at. When they look at, as far as like the way the MRIs look and the depositions, kind of the pre-Alzheimer's findings depositions, if you give women estrogen, it's like those MRI findings are not as bad. So, there's all this suggestion that this may be helpful. And I've even had somebody present me with, well, something I read was that my mom has some cognitive decline. Should we put her on hormones? And I'm like, well, she's over 65, so no. If I try to enter that order, the computer's going to tell me I should not be doing that, and her insurance company will send me a nastygram saying that I'll be giving her something that could cause her to have a stroke.
Yes.
So it's just there is so much just mystery about hormones, and truly, like I told you, when I saw people in 1996, when I was doing my residency in menopause clinic, when I consented people for hormone therapy, I would tell them, well, the benefits are it decreases your risk of heart disease and stroke and may delay the onset of dementia or cognitive decline. And then in 2002, it was like a total game changer. And It was like, wow, everything I thought I knew, I didn't, it's just been thrown out the window.
Have they really had enough time, though? Has there been enough time span to really study that to come to a conclusion?
Thousands. That's the thing about the Women's Health Initiative. there were so many people in it that you could detect even small differences. But the most important part of hormone therapy is quality of life, just making sure people know what the risks are. And, if they're willing to take those risks, even if they're small, that their quality of life is going to be better. And it is, for some people it's worth it, because if you're miserable, they're willing to take those small risks. Now, I wanted to touch on bone health.
Yes.
That's another thing. The weight-bearing exercise ideally impacts. Every time your foot hits the ground, the little osteocytes get a message to secrete harder bone. So, one of the most important things you can do for bone density is weight-bearing exercise, your calcium, your vitamin D, 1,000 to 2,000 international units a day, and then also magnesium is good for bone health. And of course, I always learned in, one of the things they teach you in medical school is magnesium is good for people.
Yes.
People use it for, the muscle aches and cramps, and also anxiety. And if you are having diarrhea, then you're getting too much. But most healthy people, an extra magnesium supplement a day is not going to hurt them, and it's good for bone health. So, just wanted to touch on that, because that is a menopausal specific risk, and hopefully people have been, your bone health is one of those things that's kind of like the money in the bank. You've been building bone health your entire life. So hopefully when you get to be, menopausal, when you start losing bone, you've got nice dense bones, so that if they thin a little bit, you're not going to break a hip, or you're not going to, start shrinking because your vertebral bodies are collapsing. bone density studies, we start at 65 for the average patient. Now, if we have that patient that has had a hysterectomy at age 38 because of endometriosis or breast cancer, then or has had our ovaries out, then we may start younger. Or if somebody's a heavy smoker, they had a mom that broke a hip, that kind of thing. There's something called the FRAC score that we can kind of use to decide if somebody's a candidate for therapy. But most women don't want to take a bisphosphonate, and that's another thing about the hormone therapy. If you take a hormone therapy, if you take estrogen, that also helps your bone density. So you're kind of, in addition to your hot flashes and all of those things, you're hitting on your bone health. Your heart health, we talked about that a little bit and talked about the exercise and the importance of the diet. What do you tell people about omega-3 fatty acids, or what's your opinion of, or what are like the cardiologist or the internist's opinion on omega-3 fatty acids?
You can find different opinions on different things, but I think most of the cardiologists out there, especially those that are vegetarian, vegan, follow the plant-based diet, the omega-3s are so important, to your overall health. And typically what is recommended is that they get it through fish, the salmon, the chunk-like tuna. But we know that most people don't get, it's like vitamin D. Most people in America are vitamin D deficient. And a lot of us, especially as we get older,
we don't get enough magnesium in our diet.
No. And I think that's what really, when you get through and you're talking to people about their health, and you try to help them understand that it is as easy as eating real food, what you put into your body, what you do for your body, that's really going to have the long-term benefits. But it's like we hear it, but we don't necessarily adopt it. And unfortunately, by the time we're at the stage in life where we go, a lot of the damage is already done. And you were talking about the bone density. I actually read an article online this morning that was recommending that women jump rope for so many minutes per day, because that would help strengthen their bones. And I'm going, wow, because I had a jump rope out back where the grandkids were playing with jump rope, and the jump rope was still on the table, and I thought, well, grandma needs to go jump some rope. But the things that we can do to really help ourselves, and then if we need and when we're having our annual visit with our gynecologist, to have those conversations about where am I. But I don't know that a lot of us get tested for vitamin D deficiencies and magnesium deficiencies and all of those other things, to kind of give us that roadmap of what we need to individualize for our own health.
We were testing everybody's vitamin D a few years ago, and they told us to stop because most people are deficient.
Yeah.
And so most people just need to be on a vitamin D supplement, and they need to get out and get some more exercise. Who does that sound like?
Right? I know, but it's just like we know it. And for the younger women who may be listening to this or watching it on the replay, prevention. What was it? Benjamin Franklin, prevention is worth a pound of cure. Yeah. Oh my gosh, truer words were never spoken.
True.
And I think about the younger people who are working hard and they're socking away money in their 401k. Because when they get to be our age, 65 and older, which, you're a little younger than I am, I think. But when you get to be in your mid 60s and you're looking forward to hopefully retirement, and you're putting that money away, well, wouldn't it be great to spend that money on travel or things that you want to do instead of prescriptions and going to the hospital and having a major health event?
And having to take a COVID test to get into the hospital.
Thank you. So, take care of yourself now. So if you're a younger woman watching this, take care of your body now. If you're middle age, still, as you said at the very onset, it's never too late.
Well, and for the younger folks, always remember what you hear on the airplane. When if in the event of loss of cabin pressure and the oxygen mask drops in front of you, if you're traveling with a child, put your own mask on, and then take care of the child. And of course, we all, we put our own needs last.
Mm-hmm.
And ultimately, eventually, if you take that to the extreme, you're going to eventually have to give yourself some attention, and it may not be the most convenient. If you're sick, it may not be the most convenient thing for your family. So, a little bit along goes a long way. Do we have time to talk about sex really quick?
Sure. Hey, we've got all the time you need. So if you want to talk about that, we'll just dive right on in. Sure, why not?
Well, we could talk, briefly about mental health.
Mm-hmm.
Mental health is a big issue in all stages of life.
Yes.
But depression is a symptom of menopause.
Mm-hmm.
Depression, the lack of sex drive and lack of interest in sex and in life in general is a symptom of depression.
Mm-hmm.
And so when I have somebody that comes in and says, periods are getting less, I'm having some hot flashes, and I am not interested in sex. There's a lot of things that can be going on there. It's very complex. Are you mad at your partner? Because typically women don't like to have sex with people who they're mad at. We're funny that way. Are you depressed? I kind of can tease into, are there other things that you normally enjoy doing that you're not enjoying right now? But a lot of times the issue is that it's not that they don't like sex, they just don't think about it all the time. It's just one of those things, I'm too tired or whatever. But when I start having sex, and that's what I ask them. When you start having sex, do you enjoy it? Well, yeah. It's like, okay, well then you have to make time for that. It's kind of like me. I don't sit around craving going to the gym and getting on the treadmill. But when I get there, I think, oh, wow, this is nice. I feel good. I should make time for this. Same thing with sex. Now, if it's painful, if it is, and you dread it and you look for ways to avoid it, then that's abnormal. That needs to be addressed. And sometimes the pain can be addressed with something as simple as some vaginal hormones, and that poses very little risk to anyone. We didn't talk that much about hormone therapy specifically, but as far as thromboembolic event, transdermal hormones have a lot less risk of heart attack, stroke, or pulmonary embolism, deep vein thrombosis than, say, taking a pill. So I typically, preferentially, whether somebody has risk factors for cardiovascular disease, heart attack, or stroke, I try to put them on a patch instead of a pill. Now, unfortunately, sometimes insurance won't pay for a patch. I have to go, if I want to treat their symptoms, I have to put them on a pill, even though it's not my favorite. But for women who have just kind of straightforward lack of sex drive, I'll tell them, look, we have not changed physiologically much from when we were cavemen cave women. And when we were cave women, if we lived to be this old, if we survived all our childbirths and did not get eaten by a saber-toothed tiger or die of an infection, or starve to death, we would not be having sex with the cavemen. We would be taking care of the little cave people, and we would be hunting and gathering and doing all of those things. Mother Nature did not mean for you to have any more children at this age. She therefore did not give you a sex drive. And the women who have these big, voracious sex drives, that's awesome for them. But if you're feeling like there's something wrong with you because you don't have sexual thoughts, that's not abnormal. It's just, it's kind of a normal part of life, and you can't define yourself by that. And if it's one of those things that you enjoy when you get going, then you kind of have to just remind yourself periodically to get going. And you don't have to tell your husband, okay, it's 8 p.m. and
Saturday,
or it's Friday night. I'm going to need you to turn off MacGyver, and we're going to, this is going to be our time. Kind of like that chicken bad moms that,
Mm-hmm.
it's every Friday night after Blue Bloods. Now, if you wait until after Blue Bloods, then you're too tired. So you want to make sure that it's at a time when you feel energetic.
Mm-hmm.
And you don't have to tell him that you're planning it. You can kind of move the time around so that he doesn't get the idea that this is something that you have planned. He thinks it's spontaneous. If he wants to have sex every night and you don't really feel like it, but like once or twice a week, then y'all kind of have to come to an agreement as to, what the frequency is going to be. But for people who truly have a low drive, there is a medicine out there called Addie right now. I haven't actually prescribed it yet. When it first came out, if the big thing was if you drink, you can't take this because it'll make you pass out. So
Oh.
women were like, no, I don't want to take that.
Uh-uh.
It seems like it may be, they've kind of backed off of the FDA warning. It's like if you've had a drink or two, you shouldn't take your dose for like 2 or 3 hours. And if you've had 3 drinks, then you should miss your dose until tomorrow, that kind of thing. Sometimes we treat women with Wellbutrin who have low sex drive, and that works. But it is one of those things that you should not be afraid to talk to your doctor about, because we're kind of expecting it. It's part of and ideally you don't wait until they're about to walk out of the door. They call it the doorknob question. You have your
It's like,
hand on the
wait,
doorknob and the person says, one more thing.
wait.
I'm kind of embarrassed about this, but I just don't really feel like I want to have sex. And then it's like, oh boy, this is another 15, 20, 30 minutes. So it's one of those things you want to bring up, or, kind of have your list of questions that you want to ask, more than one, but not 30. And you address those things over the course of your visit, because, that visit with the doctor is your time, and we want to use it to address the things that you want to talk to us about.
That's great because I think a lot of women, we're in a different generation. When my mother was growing up, there were just certain things you didn't talk about. And then my grandmother, there's just certain things you didn't talk about. And so when you're coming on the third generation of that, I know when my daughter came along and I thought, no, if you need to talk about this, we will talk about this. It's life, it's biology. This is no big deal. But I think we had to shift some of those paradigms so that we feel comfortable talking about those things. But because we haven't been able to really openly through the generations talk about these things, there is that timidity and that, do I want to bring this up? And is every other woman like me at this age where really I just want to sleep? It's like sleep sounds really good. But to know that this is a natural part and it's not abnormal, and to have the confidence, to have these conversations and to talk. So I'm glad you brought that up because there's probably a lot of women thinking those same things, and women that may be going through things, because we know with men, we see heart disease in men 10 years before women. So we start seeing changes in them big time in their 40s up to about age 45. And you've got those dynamics going on in both of you, and knowing how to handle all of those shifts. And how to communicate, because it can create a lot of stress in the marriage and not knowing how to talk about it. So I'm glad you brought that up, because there may be somebody who's sitting there having that kind of wondering, am I normal? Is this what life is going to be like? How do I work around this? Do I need medication? Do I need something else? So thank you for that.
Well, and you think of menopause or this time of life as like it was the best of times, it was the worst of times. It's like it feels like your body is falling apart. It's like so far, the worst part is like not being able to see, the whole vision changing. I used to have eagle eyes, and it was just like, really? But you hear people say, I feel like I'm falling apart. Mm-hmm. However, also, for some people at least, you're enjoying that empty nest, less responsibility as far as child rearing. Hopefully people are, feeling a little bit financially comfortable, so you've got a lot of different things to look forward to, but you've also got some health issues or other things that, and not everybody's happy about that empty nest. I'm sure it's kind of a, it's kind of a, a bittersweet type thing, whereas I can't believe my children are grown. However, it's like, oh my goodness, I've got all of this, freedom that I didn't have a few years ago. So it's just making sure that you're healthy enough to enjoy that next chapter, whatever it brings.
And you asked me a question earlier. I'm going to rewind for a second. You asked me the question about the omega-3s, but I didn't ask you what your opinion was on the omega-3s. So do you want to share your opinion on that?
I think that is, if you can, number one, if you can remember to take them. I always buy them, and then I get tired of them sitting on my counter, so I put them away, and then it's like out of sight, out of mind.
Very good.
I think there's very little risk with them. They do thin your blood a little bit. I noticed, like,
Mm-hmm.
when I was taking them, regularly, like I went and shot a shotgun, and I had like a big bruise on my shoulder, and I figured it's like, that must be the omega-3s, but they're good. We use them in it's recommended that they're used in pregnancy. They're good for fetal brain and eye development, but they also may help with decreased risk of heart attacks and stroke,
Mm-hmm.
maybe decreased risk of dementia, and also anxiety and depression. So they don't, I don't think they're FDA approved for any of those things. There was a time when every single one of my patients that was seeing an internist was on 1,000 milligrams of fish oil. And so it's one of
Mm-hmm.
those things that, may have kind of gone out of style a little bit, but we definitely still use 200 milligrams of DHA in pregnancy. And to me, really the only side effect is the fishy burp back if you're using
Mm-hmm.
the capsules. So I think it's one of those things for people who like to take supplements. They can. Ideally, like you said, you get it through your food, your wild caught salmon, or one of those things.
And I think
But
it's important if you're going to take the omega-3s that you know the source
yes,
of those omega-3s, and it is the wild caught, the Alaskan, and so it's really
and there's
important to.
plant-based, if you're trying to do the plant-based lifestyle, there are plant-based forms of
Mm-hmm.
supplements with DHAs.
Yes.
I think it's one of those things that may help, and it's definitely not going to hurt.
Right. And most cardiologists that I follow, they are proponents of it. Every now and then you'll find somebody that writes something, but you can find something out there just about on anything that's pro and con. But thank you so much for your time and your information.
Well, wonderful to
This
see
has
you.
been
I miss
great.
everybody.
I know we're ready to get back and start socializing again. And you had sent us some great links about menopause and sex in menopause, and I have put those in the chat box. And whenever we take the program and we put it on the YouTube channel, I'll make sure all of those links are in there too as a resource. But I'm going to sign off from you for a second. But thank you, Susan, so
Thank
much.
you.
And several people
Yeah.
in the chat talked about how beautiful your office was. They said their gynecologist doesn't have an office like yours. So I'm like, it's after hours. She's not in the office. But thank you so much, and I will see you soon.
All right. See you later.
Thank you, dear. And so that wraps up our doctor chat for our National Women's Health Week. Thank you guys so much for joining us. And one of the things that, and I actually clicked off of my link here. Let me see if I can find it. Of course, I clicked off and didn't save it. But one of the things that we have been doing all week is that when you watch one of our programs this week during Women's Heart Week, we have had a contest. So what we're going to do, forgive me for doing this while I'm talking to you at the same time, but what we're going to do is we are going to give away on Sunday. We're actually going to give away two $50 Amazon gift cards. The reason why we're doing Amazon gift cards is because we have women who are watching this live and they're watching it on replay from all over, and we figured everybody could use something from Amazon. So maybe you need some more vitamin D, or you need some omega-3s, a new pair of yoga pants. That $50 gift card can come in handy. So we're going to give away 2 on Sunday at noon. We're going to draw on Facebook Live. The link is in the chat box. And our secret word for this is happy heart. All right, so you had to watch to the very end to find out the secret code. So just enter that into the online entry form, put in the code. You can enter as many times as you want. So if you watch every day and you get the new secret code every day, the more times you watch, more times you can enter, better your chances to win. So on Sunday again at noon, we'll do that on Facebook Live and you'll be able to see that. Now tomorrow, so the secret code is Happy Heart. And tomorrow we are going to wrap up National Women's Health Week at noon with Sara Dobrowski da Costa from Synergy Yoga and Wellness, another of my favorite ladies who is doing great things when it comes to health and wellness for women and their whole family. But tune in tomorrow at noon on the Heart to Heart Foundation Facebook Live as we celebrate again. Again, our secret code is Happy Heart. So make sure you go and enter. So that ends this session. Thank you guys for joining us, and make sure you check out the links there. This will be available on replay. Have a great rest of your day, and remember that the better you love your heart, the longer it can love you back. Stay heart healthy, and God bless.